Thank you for joining us for this Advent Health virtual seminar. We hope you'll find the material presented helpful and informative.
Hello everyone, this is Dr. Ketul Chauhan. I'm one of the interventional cardiologists here at Advent Health Wesley Chapel. I currently work at Premier Heart and Vascular. Today we're going to be talking about COVID and how it affects cardiovascular overall function. Under current pandemic, cardiovascular systems are affected quite significantly. Almost 80% of people who are admitted to the hospital get affected because of COVID and its effect on the heart. And up to 25% of people, after they leave the hospital, up to 3 months, still have some form of inflammation that keeps affecting them. It all starts out when patients are admitted to the hospital with COVID infection. The underlying principle is that there's a widespread inflammation in the body, that eventually inflammation affects the heart as well. And that can cause sometimes something called a mismatch related heart attack, where the demand is quite high on the body and the heart and low on oxygen, that leads to these tiny, small heart attacks. That has a major implication overall long-term prognosis. The second effect it has that it can lead to direct myocardial infection as well, called myocarditis. And the third effect it has that sometimes it can cause reduction in heart function. And all of these things can present while patients are admitted into the hospital. And this affects almost 70 to 80% of people admitted in the hospital currently. The second effect COVID has, it can lead to microvascular damage, where it starts hurting tiny channels of the blood vessels. That can lead to stroke, can lead to clot developments in the heart and in the lungs, and that can cause major damage as well. The second aspect is that it can also cause dysregulation of your blood pressure and heart rate. So people and patients can have sometimes long-term effect where they continue to feel tachycardic, they can have blood pressure dysregulation, and that is all lingering effects from the COVID. Overall, the prognosis is still pretty good, fortunately. Most people whose heart function is not damaged, they do very well over time, but it takes some at least 3 to 6 months when the heart starts healing. But if you have underlying some form of damage, there's a 25% chance that you will have some form of cardiac long-term management that will be required. And finally, this field is rapidly evolving as we're in the middle of the pandemic. We're starting to see some dedicated cardiac post-COVID clinics. They're starting to happen. It is incumbent upon us, the patients and the physicians together, that we're diligent about following up and have an idea of early diagnosis and follow-up. Overall, together, we can heal all heart. And this is Dr. Chauhan. Thank you.